about, but does it work? It does work. And just because you're doing therapy doesn't mean it has to be painful. Therapy doesn't mean it has to be really rough. You know what I mean? Just by placing your fingers in between, what you get to do is you get to stretch the ligaments that are holding these bones together. And then the muscles, we have muscles in between. I know, it's like they're so small. How do you even see them? Because you're comparing yourself to bigger muscles. But we have little itty bitty muscles. If you turn to the side, you can feel them. They're in between your bones, and they sit in here, and they come, and they actually affect how your fingers move. So just by clasping your hands like this can really give you a really nice stretch. This is great for anyone who has really tight, stiff fingers because their wrists had surgery. So that's a really good one. Another thing is just trying to make sure that you move your fingers as much as you possibly can. And that's what we do in therapy. You want to make sure there's a little bit of space in between, but you're going to curl down into what we call a hook fist. So that means you're going to bend your middle knuckle and your little knuckle. This is called a hook fist. And you should be able to do whatever your other hand does, right? Don't compare yourself to me. Compare yourself to the other hand. And I'm sorry if you hurt both hands, then we just should be going to a therapist. Anyway, so this is called a hook fist, and then we can go into what's called a full fist, and that means you're able to tuck your fingers all the way in. This is called a straight fist, and that means that you're going to bend your big knuckle, little knuckle, and then your little ones stay straight. And one of the reasons why these finger exercises are so important is because they help to glide those tendons past your wrist. Now, if you injured your wrist, you need to make sure that those tendons are gliding through your wrist in a way that doesn't hurt, and it allows your wrist to actually loosen up. Now, if you're going to make a fist, make sure that you really focus on opening your fingers nice and wide. When you open your fingers, you're going to move the other tendons that pass on the other side of your wrist, and you need those tendons to move on both sides in order for your wrist to be able to move really well, right?